Do your hips feel out of alignment and you're trying to figure out a way how you can self-align your hips while you're at home? My name is Greg Schaible with SportsRehabExpert.com, and today we're going to be talking about how you can correct a hip alignment issue real quickly. Now, before I show you the exercise, I do want to mention that hip misalignment, hip leg length or leg length discrepancies gets overdiagnosed way too often. Understand that if your PT, chiropractor, or anybody just looks at your legs laying on a table, there's a ton of variance that can be happening when you do that test. Research has shown that that test is extremely unreliable, and if you get up and walk around and then get back on the table and then look at that test again, it changes quite often. Even on imaging, depending on the points that you're looking at, the appearance of leg length can even happen on imaging when there's not true structural leg length changes. So you need to be careful diagnosing someone with a leg length discrepancy, because many times people get labeled with that diagnosis and think they have a real big issue, when in fact it's not true whatsoever. Even worst case scenarios is someone will give somebody a heel lift and then they wear a heel lift on one side of their body for years on end and they never actually had a leg length discrepancy. You'd be surprised how many times I've seen that on the clinic. It's unfortunate. Now, that being said, you do have two sides to your pelvis, two innominate bones that meet together at the sacrum, and there is some degree of variability in how much that pelvis can rotate, specifically in the sagittal plane, meaning anterior posterior tilt. That is the direction of question here, and in my opinion, someone who benefits from these hip self-alignment activities, again, I don't think you're aligning anything, but that's what everybody searches on YouTube and what people call it. What you're actually doing here is you're just mitigating tendencies. So people tend to sit on one butt cheek more than another. They tend to, if you're driving, you're always stepping on the pedal with your right leg. Some people tend to cross one leg over top of the other more than another. Some people tend to stand on one leg more than another. If you're playing a sport, some people are better at jumping off of one leg than another. So this leads to tendencies in the pelvis, and sometimes that tendency just needs to be managed. Now, doing that leg length discrepancy test on the table where you're looking at the ankle bones, the person's laying flat on the table, you're looking at the ankle bones, seeing if they're level, that is a way of monitoring the tendency. If someone does appear to have one leg longer than another, and that appearance happens on a frequent basis, then maybe there is some merit to that tendency. And then also, depending on somebody's symptoms, and if they respond to one of these activities and they respond positively from a symptomatic standpoint, then that gives you a little bit of more ammo or reasoning to be doing this exercise. But again, it's not because you're aligning anything. If you are in perfect alignment, that means you're never moving. Moving changes alignment, and so it's totally fine to get out of alignment, because you have to move one pelvis in front of the other pelvis to move forward when you're walking, lunging, doing a lot of different activities. So you never stay in perfect alignment with your pelvis, because your pelvis is always moving and one side of your body is doing something very different than the other side of the body when you are walking. They're doing opposing actions. So the solution to a misalignment is actually getting the body to do an opposing action. And here's the cool thing: you don't have to really worry about what side of the body it is on. If you just start alternating back and forth between the two, then a lot of times your body figures out how to find center a little bit better when it comes to measuring or looking at a static posture. So this would be my go-to exercise at home to manage a hip alignment issue. Again, all we're trying to do is get the pelvis to move in opposing directions so that the body can self-organize and find center a little bit easier. So what I'm going to do is I'm going to push my heel down into the couch, coffee table, an ottoman, whatever you have available to you, as if I'm lifting my hips up. Now, my hips don't actually have to go up for this exercise. I'm just isometrically pushing down into the couch here. And then with the opposing hands, I'm going to stabilize as I push my knee up into those hands. So I'm feeling my hamstrings and glutes push down into the bench. This is the most important leg here. You want to create the most tension pushing down, but I'm also trying to create tension as I push my knee up into my hands, feeling my hip flexor work as well too. If this is uncomfortable, lower it a little bit further if it feels like your hip flexor is going to cramp on you. And you're just going to hold this position for 30 seconds, 20 to 30 seconds, giving, about 70 to 80%. You don't have to kill the exercise. And then you're just going to repeat the same thing on both sides, again, alternating back and forth. One leg is pushing down, one leg is pulling up, and that's going to create an opposition of the pelvis, which again, when you alternate back and forth, the body self-organizes and finds center a little bit easier. So that's your hip alignment exercise. You're not aligning anything, you're just simply helping the body self-organize and find center a little bit easier by moving the pelvis in opposing directions. And a lot of times, if you're experiencing low back pain, SI pain, anything that might be coming from a tendency to put weight on one side of your pelvis more so than another, this will help that issue out. And so if you actually need to manage your hip position tendencies, then what you'll notice is that this has a very immediate response to your symptoms oftentimes. So if you're experiencing low back, SI kind of tightness in the small of your back there, oftentimes it feels looser after doing that exercise. If it doesn't feel like it changes your symptoms, this probably really isn't that meaningful, and you can kind of throw this idea out because again, if it's going to be useful for you, you should notice a pretty quick change happening. If you do notice it useful, some other exercises to consider being helpful or beneficial for you is turning that hip setting drill isometrics into something where you actually move your legs dynamically and make the exercise even more challenging. How you do that would be level one is actually doing a bridge where you're lifting up and down in this position, just feeling your glute and hamstring lift you up. You don't want to arch your back and thrust your chest up towards the ceiling. That's where somebody's going to feel their low back with the exercise. So I like to keep my shoulder blades down. Everything south of my shoulder blades will lift up. And again, doing that isotonically where I'm lifting up and down on the bridge, that becomes a very useful exercise. And you can repeat that, obviously, on both sides of the body. Another way of doing this dynamically is by holding the bridge and then with your opposing leg, swinging it up and down. Again, what does this do? It gets your pelvis performing opposing directions, and it makes the exercise more challenging because it's dynamic and I have to hold integrity on this opposite side pelvis. And then what would I do? I would repeat that on both sides, going through a full range of motion. All right, so there you have it. 2 exercises you can do to help manage hip positional tendency issues out or hip alignment based issues out. Give them a shot, see if you notice a change. If you don't, again, you probably don't have to worry about this being an issue. You should notice pretty quick change happening in your symptoms. Doesn't mean it's gone, it just means that you should notice a pretty big change in the area of discomfort, feeling quite a bit better after doing it. Doesn't mean it's gone, but again, you should have some sort of positive re-encouragement that this activity is useful for you to prioritize it as part of a rehab or exercise plan.